I know exactly.
Ma'am, shall we start?
Yeah, we'll start. That's what I said. No, we won't be anybody. One is it's the timing.
Yeah, you know what? You just do it and go on.
That's all.
It doesn't bother me.
You improvise and you just do it.
Having done so many, it doesn't bother me. Because she Kalibo boarded.
Yes, ma'am, because she came yesterday also.
Yeah,
so there was no audience for her. She
was upset.
Yes, ma'am.
Okay.
Yes, of course.
Thanks. Good morning. Thank you so much. I think today we're going to be talking about investment in public health initiatives. And let me get started. So, one of the objectives of this presentation today is I'll be discussing why we need to invest in public health and highlight some examples of success stories globally in public health and explain the link between Millennium Development Goal 4, 5, 6 and the SDG 3. And just by the way of introduction is that I am a physician and I'm a professor at New York Medical College. But one of the things is that we have really been focusing a lot on improving the health of communities, especially within looking at the social determinants of health. And I really like this quote by Benjamin Franklin, one of our great statesmen in the United Nations, and also I can say globally. It's saying an ounce of prevention is worth a pound of cure. That's why we need to invest in public health. Because if we invest $1 today, over the next couple of years, this dollar will multiply so many times. Okay, so this bike, everybody is biking now to go to work. Unfortunately, some of us who live in certain places like New York, if we bike to work, it will be taking us 5 hours each way to get there. But that apart, public health can be a part of the solution. So when I was doing this PowerPoint, I realized that, I really like this slide because what it shows us, as you can look into it, these are some of the determinants, so social determinants of your health status, whether it's an individual or a community. So you have green spaces, it's where you work, it's the environment which surrounds us, it's housing, that means it's where you live, and also your transport, which is really important, because how you go to work. And housing is where you live. If you live next to a slum, like those of you who've seen issue. And then violence prevention. We have so many types of violence. We have interpersonal violence. We have self-inflicted violence. We have gender-based violence. We have community violence. We have societal violence. So this is another issue. Violence prevention, healthy nutrition. Now, when you come to a meeting, at least that's what we say back in the United States. Like at least some of the health meetings, we try to say, don't have cookies, don't have muffins, don't have croissants, because you're just loading in and loading in. So when we are having a conference on health, if you're serving a breakfast of 2,000 calories, it just takes away. And no sugary drinks. This is another issue. A couple of years ago in New York, there was an initiative where the juice being given to students was totally taken off because it was sugary drinks. It's not fresh juice. So we need to promote healthy nutrition at an individual level and also a community level. Tobacco control. It's nice to see that, in all my visits coming to India, at least now the people are not smoking indoors. I remember a couple of years ago when I was coming to India after a while, I go like, when we landed in Bombay or something, it's like there was a no smoking sign and this guy is lighting a cigarette. It's like I went up to him and I said like, why are you smoking? Can't you read? And he looked at me like I was some creature. I go like, I don't care, you're smoking. So if you see something, say something. And then, so we have all these tobacco control initiatives, but one of the challenges we're facing is the social marketing of tobacco is so powerful. And in so many developing countries, they make cigarettes, they put them in cases like perfume bottles, or you get a freebie. This is to entice the younger smokers. Limit alcohol, that is an issue too. And you know what bothers me is people, at least in some countries, you have stricter laws. I mean, somebody was telling me the other day, it's slightly improved here in India, which is good. Like, people like on a weekend or a Friday night, they're drunk, they're driving, look at the problems. So again, we have to really enforce all this and make people accountable. Now, so why do investments matter? Okay, so people might think, oh, I'm not going to invest, I'm not going to come for a talk early in the morning, or I'm not going to come for a talk in the night. So whatever we do, sometimes we think as what are we getting back from it. So the returns on investment can be like immediate, they can be after a few years, or they can be long term. So one of the things about return of investment is, as you can see, cost-effective approaches where the financial benefits to health and other sectors outweigh the initial investment, giving a return on investment. Example, smallpox, eradication. Remember, smallpox used to be a problem many years ago, and in the 1990s, it was finally eradicated. But it was a very long process. People didn't get tired, they went on doing it, and now the world is smallpox free. So that is a return on investment. The same example can be used for cost saving. So the society was willing to pay, invest in smallpox eradication, and this saved so much of money. And cost pressure business as usual. The other thing is continued delivery of current practice with predicted increase in healthcare costs over time. If you want something of quality, well, you got to invest in it. You got to pay for it. Okay, so this slide, I just wanted to say, example, I tried to make it bigger, but it was kind of a little challenging. But I think, yes, it can still be read. So what are the environmental determinants? Is road traffic injury prevention by active transport, green spaces, like you can't have people biking on the sidewalk where you're supposed to be walking. That is a safe place designated for pedestrians. Then you have a heat wave plan. What is a heat wave plan? Place like Delhi, you're walking on the street taking in the sights, you can faint, or somewhere where it's hot. So what is the plan we have? Because again, this is related to the environment, and that's called a heat wave plan. Then what are some of the social determinants? That is healthy employment programs. That means it's one of the things is there's job rotation. Like suppose you were working outside for 8 hours in heat like this. You would work for 4 hours, you would work for 4 hours, and then you would rotate. So that is it's a healthy employment program. And also the other thing is that you have adequate protective accessories, like you have gloves, you have a mask, which fits you. In many places, the masks and gloves don't fit the women who are working at high-risk jobs. So these are the things we need to be thinking about. Then healthy ventilation for asthma community. One of the challenges is, if in a room like this, people can be cooking, and they can be 40 people or 100 people. So you can imagine what will happen to the quality of air. Can you imagine if we started lighting a fire to make a barbecue here? Apart from the alarm sounding, it is also a question of the air quality. And also lifestyle diabetes prevention program. Now many places, especially the Caribbean, has been very, very proactive in having healthy days where everybody in the community starts walking. You do your exercise, or you have like a group activity. So this is all being promoted now. And then what are some of the other long-term gains? Like you have removal of lead and mercury. Now in so many places, there is still lead in the pipes in the US. Now it's outlawed, but in the past they were. So when you're removing the lead, that's important, from lead-based paints. All these are public health investments. Then you have pre-school programs, and then you have prevention of conduct disorder. That means if somebody, especially with the recent gun shooting incidents we've been having, if you see somebody who's a little weird, who the only thing that child can talk about is violence or guns or something like that, then you need to start thinking of, okay, we need to maybe prevent this and see how can we address this. Now, what are the other great public health success stories which we have invested in? Vaccinations. Pneumococcus, rotavirus, influenza, pneumonia, screening. Cervical cancer screening, the Pap smear is so effective. That's one of the cancers, if caught, can be treated almost fully. But the problem is getting the women to come for Pap screening. And I tell so many of my friends, I went to medical school initially in India, but whenever I come back, when I'm talking to some of my friends and colleagues from my past life here, they go like, yeah, these people don't come for Pap screening. I mean, we have billboard advertisements, maybe advertising a beer or advertising something else. Why don't you have advertise for screening? Because it saves lives. People will spend thousands of rupees buying new clothes, but they won't go for a screening. That is an issue. And also, treatment of cardiovascular disease, frequent checkups. See, and there are different kinds of prevention. There's primary, secondary, and tertiary. Primary is you prevent it from initially coming. Secondary, you prevent, okay, it's already set, but you want to either prevent it from becoming worse. Tertiary is you try to fix what is broken by minimizing the effects. So, and then again, the treatment guidelines of the WHO, which is, as we all know, is the biggest public health agency, are pretty cost effective, and even treatment of asthma. Okay, now, evidence, because we all need evidence. So, the American Public Health Association estimates the return, ROI is return on investment on major public health programs range from 125% to 3,900%. Nowhere else, even Wall Street, you will not get a 3,900%, which will be stable. Because today, if the stocks are good and you go like, yeah, I'm making $1 million, tomorrow it may tank. But public health is more steady. Okay, so this is a great example. Every $1 invested in adding fluoride to drinking water, fluorination, saves $38 in dental care. You see? So what is the return in investment? It is 3,700%. I didn't do the math, the experts did the math. Okay, Thailand. Thailand has made such great strides in health. And look at this, they have these specific bike lanes here where people are biking. Okay, now, and New York City, we've been investing a lot in bike lanes, and the thing is you have your bikes parked. So if you have that membership, you get a card, so you can take a bike, go somewhere, leave the bike and the helmet there. So that's it, like you don't have to bother about where am I going to keep the bike, you just keep it in the specific place. And this is a public-private partnership because they've invested with Citibank. Citibank has provided them funds to buy all the bikes. So every $1,300 invested in New York City in building bike lanes provided benefits to 1 additional year of life at full health. So can you imagine, only for $1,300, you have 1 person, year of full life for all the city residents. It's not 1 person. So it's not that per person you're investing $1,300. If you invest $1,300 more in creating a bike lane, it is helping, it is giving 1 additional year of life at full health for all city residents. Okay, and so these are some of, this is a picture from New York, and you can see what is the thing of having all these trees. First of all, increased oxygen provided for people, less pollution, there's shade, and also the temperature also. There is a link between climate change and tree planting, even though some politicians think there's nothing called climate change. Let's not even go into that. But I'm just saying that this is something we need to be thinking about. So why do we, and I really like this quote by Bill Gates, we invest in global health because we know that when health improves, life improves every day. So that's why you have all the foundations and public health agencies investing in global health. Now, smallpox eradication. I mean, this is one of the biggest public health triumphs of all time. I don't care if you're a health student or not a health student, but you need to understand that, especially for the younger people, that this was a terrible, terrible scourge. It was like the plague a couple of years ago, and it was not even in that century. It was just a couple of years ago. So in 1966, there were approximately 10 to 15 million cases of smallpox, and 1.5 to 2 million people died. From the world, this has been eradicated in 1978. So can you see, do you think of any other thing in the world which has given so much of public health benefit? It's improved the quality of life. If somebody says, I don't care about health, I'm healthy, you're healthy because of all these investments made. And to continue staying healthy, you need to make investments on a multi-tiered basis, on your local, personally, individual basis, community, state, country, international. Now, we had the Ebola crisis. We had Zika crisis. How do you think we address this from going beyond? Yes, there were challenges because everybody got together, resource pooled, data sharing, using all the media, even social media. So this is how you use technology for improving health. Polio also. Now, why do you think eradication of polio is a challenge? Because in so many places, Pakistan, they're killing polio workers. They have killed so many polio workers. Because they think that this is, polio is kind of not, polio workers are, talking about things which are going to corrupt the minds of young people. No, they're just trying to help immunize. So this is another challenge. And also because of the route of transmission of polio, and there is what is called the wild polio strain, which is a big challenge because we really don't have the current immunization addressing it that effectively because it mutates so fast. So these are some of the challenges we are facing. Even then, we are pretty much almost 97% polio free. And India, it's amazing, for the past couple of years has been totally polio free. And they've maintained it. It's 4 years going on to 5 years. Now, the other challenge we have is the route of transmission. And in some countries, and Nigeria is another hotbed, Afghanistan, Nigeria, Pakistan, of polio. And one of the challenges is some people believe that polio vaccine can cause infertility among women. That's why they don't want the girls to take polio vaccine. So what I'm trying to say, all these challenges. So there's so many things which really matter. Okay. So who are the partners in public health promotion? We have the United Nations agencies like the World Bank, the WHO, UNICEF, FAO, UNFPA, UNDP, UNHCR, all these working together. Then we have foundations like the Gates Foundation, the Rotary Foundation. Rotary Foundation has done tremendous work on polio eradication. Then we have the United Nations Foundation, which was established by Ted Turner. So all these. And then we have governments, especially some of the countries like Sweden, Japan, Norway. They're really funding, and the United Kingdom has the DFID program where they invest in health. And then we have academic institutions because we have so many universities, including my own medical school, where my colleagues make the influenza vaccine every year. Because the thing, every year they have to develop a new vaccine for influenza because of the strains. They are different. Then we have think tanks. We have meetings where people get together and think, and we have a lot of non-governmental organizations working across grassroots with other partners in addressing this issue. Now, these are the Millennium Development Goals, and these are the Sustainable Development Goals. The Millennium Development Goals came in, they were adopted in the United Nations by the member states in 2000, from 2000 to 2015, and in September 2015, the MDGs morphed into the SDGs. So you can see the various MDGs and SDGs. Now, if you look here at the MDGs, Goal 4, reduce in child mortality, 5, improve maternal mortality, and 6, look at HIV, AIDS, and the other chronic diseases. And then if we move over, you can see there were 3 health goals specifically mentioned in the MDGs, but in the SDGs, it is health for all at all ages. That is goal number 3. So, what is this? Basically, if you don't have health, you don't have development, you don't have progress. People need to understand that. And you know what? It's everywhere. It doesn't matter if you live in which of the 6 continents you live in, because Antarctica you can't really live in. So that's why I said it depends on which of the 6 continents you live in. Unfortunately, you don't have specific policies addressing health. And the slashes, the budget cuts to health. Everybody, we'll cut from health. Okay. You're sitting on a tree, you're cutting away the branch, we'll cut from health. We'll put in defense, we'll put in some other stupid thing. But you're cutting away from health and education, which are the vital pillars of society. This is a challenge. Now, in conclusion, why should we be investing in health? Because if you invest in health, you're investing in sustainable development. And the SDGs are the Sustainable Development Goals. So you have social justice. What is social justice? That you need to have a policy, and you need to enforce the policy or have practices and strategies in place, even at an individual level. Now suppose, I want to go shopping and I want to spend more money buying 100th pair of shoes when I already have 99 in my closet, instead of donating that money, which will help somebody. So that is social justice. And it needs to be at all levels. And then universal access to health services. If you pay, you get the best health services. If you don't pay, it's whatever, But that's not the thing, because everybody needs to have the same access. And health is a human right. It's not a luxury. Then economic growth, because the growth domestic produce increases if you're investing in health, employment, and human productivity increases. That's why if you see, there was a report produced by the WHO in the late 90s, which really holds good today too, that the life expectancy for a child born in Sierra Leone, if the child is 40, it's amazing. But the child born in Japan is 82.5 years. Because Japan has worked at it. Sierra Leone has not. Unfortunately, there's so much of conflict, so many places. And also, link with primary prevention. What do you understand by environmental protection and linking it with primary prevention? That means making sure there are no factories in a residential area. Making sure there are no radioactive plants close to your water supply. And greening of health services. What do you mean? Are you going to be painting on the hospitals green? What do you think of greening of health services? Making sure that where the health facilities are, they have a lot of greenery. Because it helps. Because it also helps with mental health. One of the things I really found, driving in Delhi, I don't know if you are from Delhi. I was so impressed by how green it is. And when you go to Mumbai, you feel like puking. Because, even though Delhi it's hot, because that's the climate, but look at the greening. Even in New York City, in the midst of all those concrete jungles, you still have green spaces. So that is called greening of health services. Because a patient also feels so happy. I mean, I myself being a physician, I get a white coat syndrome. When I go for a checkup, oh, what's he going to find? It's like, okay, my hypertension, which is okay, it's not like, I go there, it's like, why is it 160? I checked it in the morning, it was like 124. So what I'm saying is, it's the environment, so greening of the health services. So these are my references, because even though this is not a scientific conference, I can never make after making so many presentations all over since so long, I cannot have a presentation without references. So, if anybody has any questions, yes ma'am.
Good morning. I'm sorry that I came in late. I wanted to know if you had spoken all about malaria in your talk, and if not, if you'd share some thoughts on the funding around malaria and the SDG and commitment to eradicate.
Yeah. I mean, like when you have a limited time, and again, I was aware that this audience is not so much of a scientific audience. Like my talk would have been a little different if I was giving it to a different audience.
And what I'm looking for is, because I am a scientist as well, but I'm looking to understand a little bit more about how to, you talked about smallpox, and how do we shift thinking to the eradication of malaria? Like, how do we get people on board to do
Okay, shall I tell you again, I hate to say it, one of the problems is malaria is not a disease of the rich countries. It used to be. But then, because of cleaning the environment, making, cleaning up the mess, cleaning up the mosquitoes, and the other politics, which a lot of people don't realize, DDT is one of the most effective anti-malaria. But guess why DDT? Because Rachel Carlson said that the bird's eggs are getting mutated. I don't care if the bird's eggs are mutated. How many children would it save? Because one of my students had done a thesis and I had guided him on, malaria eradication. And the biggest thing is that they lumped tuberculosis, malaria, and HIV together. So the funding for malaria got less. But I don't know if you've heard, like we have a program called Rollback Malaria.
Yes.
But the problem is the donor countries. Now, okay, are you from the US?
I am.
Okay, so you know what I mean. The president, I won't say our president, the president.
I appreciate that.
Yeah.
That's the way I
The
But
president.
he did sign the
PMI.
Right.
But the problem is the funding is cut so much because I have friends, colleagues from the DC area, and all of us are working in global health. There's so much of US aid funds have been reduced. So the challenge is when your funding is suddenly cut off, do you go ahead, continue with the programs you already have on ground, or do you establish new programs? Obviously, you cannot have new programs. The biggest challenge we have is the sustainable development. And also the other thing, let me tell you, even though they are donating bed nets, because I know one of the NGOs is also actively involved in the Rollback Malaria, giving out, bed nets which are treated. The problem is, the women are kicked out, the men sleep in the bed nets, not that we hate men. I've been married to one for too long. But what I'm trying to say is the women and the children still are outside. So it's that whole gender issue. And also, one of the things is, there's so many, I don't have to tell you, you're a scientist, you said, there's so many spurious medications for malaria, which are cheaper. The thing is the lack of access. If you have $1 to spend on medicines and a malaria medication for a full month costs you $5, and if this guy, spurious medication, says it's only 40 cents, would you go for the 40 cents or the $5 if you don't know the difference?
But if we're talking about investment, so I'm an engineer and we've been working on some technology around it. But I come to India because I know that there's a commitment from the Prime Minister here to be a part of the eradication process. The challenge that I'm having is how do we leverage influence to get the rest of the world on board to support what we need to do in India and Africa and other places. I lived in Africa for many, many years, so I just moved back to the States. I'm trying to understand how do we leverage influence so that people will grab the commitment to malaria the same way they did to smallpox. Even though I guess like what you're saying is smallpox affected the wealthy world as well.
Yeah, that's right. But I don't know, the way I see it, I could be wrong, but I'm thinking is if one politician's child or spouse or relative falls a victim to one of these diseases, things will change. Right? That's the thing. I mean, if it hurts personally, because if it's those people, they will say, oh, okay, whatever. See, that's the thing. Unless something pricks you, you go like, that's painful.
Right.
I think it's lobbying. Yes, I do understand, but let me tell you, till they really clean up, having a commitment is different. But the way it trickles down, if you look at the trickle-down effect, right? If the way it trickles down, if it's trickling down in like a low stream, and the final thing is not there, if you're not people unfortunately have no civic responsibility. Like, why are you throwing those bottles there? At least Delhi is a lot better. I mean, I'm originally from Hyderabad, and every time I come to India, I go to visit my mom in Hyderabad, and it's like, even in the poshest area, you just come out, you see these broken bottles, because we're just talking on malaria, and you see these tires. And if that collects water, you know that that's such a nidus for infection. So I'm saying, how do we? So unless like in Singapore, we start having fines. Unless something pricks you economically or health-wise, you won't. Why do you think we all wear our seatbelts? Would you drive out in the US without a seatbelt? Would you? In India, are they enforced? Maybe.
You saw my face.
No, because we have a fine and we have points on the license. It hurts. Ouch. I don't want my license suspended. I don't want to be put on the database. You see? That's unless.
My insurance to go up.
Thank you. That was I was coming to. Thank you for taking the words out of my mouth. So I don't want to suffer long term. But there's no accountability. If you have an accountability, right? It should be individual, it should be societal. How can you move ahead? I mean, okay, I'll give you another example. We are at this conference, right? It's nice. But did you notice people putting their hands and serving food? I'm like, use the tongs.
Right.
If they're not there, just wait for it to come or get a fork, use a fork to take it. Like they were giving those frayams at the lunch and dinner. It's like, why are you using your hands? I told the guy, put something there. No, these are the little things. And some of these people, I can go up to those women and say, like, why are you doing this? So I think unless we have some kind of, I don't know, like, we have to keep lobbying. Let me tell you, in New York City, when Bloomberg first stopped, I'm going to sit down. Bloomberg first stopped the smoking in all the bars.
Yeah, that was tough.
Yeah, no.
Not
People
for me, I
said,
don't smoke.
oh, we'll lose business. He said, I don't care.
Yeah.
Guess what? The bars are doing their business.
Absolutely.
They're healthier now because people are not smoking. Now that bars are healthy, I mean, the atmosphere is healthy. In the UN, a couple of years ago, till only like the past 8 years, till the tobacco framework, all these diplomats used to smoke inside the United Nations. It was disgusting. We'd go to the Vienna Cafe. We named it the Smokers Cafe. But with lobbying, with all the member states, because that was the only part where the rest of New York you could smoke, but people used to be smoking. It was disgusting. But then they passed the law. Now, the other thing sometimes what happens is some of these diplomats who come from overseas for some of the meetings, General Assembly or something, they're smoking outside. So it was interesting. I wanted to go up and say, I don't care, I'd say like, please, there's the security guard said, you cannot smoke. So when people see, they think they're immune to the rules because of the status you have or the money you have. The law should be the same for all, but it's easier said than done. We're having this discussion sitting in a nice room. So I think it's only with lobbying and again at grassroots. I think so. And I think it's important, and I think we need to be really focusing, I don't know, like, I think that this conference is so nice, but it should be a podium of what are we going to do to promote healthy behaviors? Have a whole session to know what can we do as a community, as a country, a region, That's why I'm so impressed by what is going on in the Caribbean now. Because we talk to a lot of the ambassadors from the Caribbean and they're like, so this is what we're doing, this is what we're doing, it's amazing. And the Caribbeans had the women had to be obese because it was a sign of being healthy if you're a little obese as opposed to being skinny. Because the whole thing was if you're skinny, maybe you have HIV AIDS or maybe you have tuberculosis. But the whole, national support, like Bloomberg didn't care. That's what I'm saying, you need to have few people like that. He just didn't care. So I think that enforcement needs to come. Everybody yelled and screamed, but now people are happy. Even in the parks, you can't smoke, which is so good. Can you smoke in the parks here? So what's the point of going to a
park? So we of course do have a policy of no smoking in public places that has been enforced. Not enforced is the wrong word. Enacted. It's yet to be enforced in full flow.
So why do you think there is that gap?
So effectively, if you ask me, Simon, the next session you will hear me talk about just about the change of mindset, right? The next session is about winning and play to win, and I'm just linking that up to malaria as well here, right? I think the problem is that everyone in our world today has agendas, right? We're individuals driven by agendas, and I think the whole idea about the whole concept of winning just plays into that. You're looking at politicians, they're looking to win their seat, right? You're looking at companies, they're trying to win customers, right? If you're looking at even healthcare, and even if you're looking at hospitals, especially in India, and a lot in the US as well, frankly, you're looking at making sure that you're making adequate money.
Absolutely.
Right? So when that is the mentality that drives majority of what this world does, we are in a situation where what you said at the end, right, and which is the one part that I caught on to, that it has to be the individuals, right? It has to be every single one of us saying no. There's a narrative the world has set for us. The world has said, as you said very rightly, the malaria is of the poor nations, right? I'm sorry, it's for human beings.
Absolutely.
Right? And that narrative has to be very crystal clear in our minds.
So that's why it's like, you go on chanting it so that you start brainwashing people in a good way.
Correct.
No, sir, it has to be, and if you see something, you shouldn't be afraid of saying that no.
Yeah.
But many people don't. They'll just say like, okay, it doesn't bother us.
But I'll just add to, so just a little bit when you ask the question about how do you get people influenced to think about malaria, right? Now, so I'm a management consultant, right? I can give you 100 ways of doing that. Make it sexy for them, right? Make sure that, that they get the limelight of having done it. And answers like that. My problem is, why do I need to think in that direction? Why is it that today, to be able to see that I need to get people of influence to get involved in malaria, I need to make it sexy for them to get
I'm
involved.
thinking, I've had malaria too many times to figure out how to make it sexy.
Yeah.
It's awful.
Exactly the point, right? But the only way that they take it seriously is if it was something that could benefit them.
You know what? So the only thing is to link it with multinational companies when we're talking is like if you are investing in places which are endemic to malaria, is like, okay, you want a healthy life, people, and you want to spend less on their medical costs. Invest in malaria prevention. But the problem is, again, it really doesn't, because sometimes there's so many people, if you are sick with malaria, okay, that's fine, goodbye, good luck. If you're alive, I'll see you in 6 months. You are around, come and work.
Because again, getting back to the thing, it's poor nations.
That's it.
Poor nations have enough number of people.
Yeah, that's right. That's the thing.
Sex.
No, but I did. No, when you were just saying how to make it sexier, so this is the thing. It's so sad. Yeah, it is
So
so.
do you believe that the platform to eradicate malaria is something that is attainable? I mean, because that's what people are talking about now.
Look, I'm
I
a
just came from
physician,
Seattle,
but
and
I'm
we're
a
talking
realist, and I would say, yay, we'll do it. I would say, maybe. But even if we eradicate it by 50%, I'm being overtly optimistic. How many millions of lives and how much of disability will that save? But again, the whole thing is, it's not a disease of the G8 countries. See, even if you look at the Security Council, where health does come up in the Security Council agenda, it's not.
You read the transcripts of how many pages
Yeah.
spent on that.
Yes, yes. And also, malaria is hardly. Okay, do you think now the UN General Assembly Assembly only 2 to 3 times has looked into health issues. The whole one special session. HIV/AIDS, chronic diseases. But malaria was not included. See, the whole thing is it's HIV. Because a bazillionaire can get HIV, but his chances of getting malaria are very less. So again, it's the economics. Stupid. That's what it is, right? I mean, if you use that term, keep it simple. It's the economics. It's money, money, money. I hate to say it, that's what drives the world. And people don't realize when they're NGOs that if you to succeed, you need to think like a private enterprise. It's like, okay, I'm doing good. Okay, today you'll scream. Tomorrow, if you don't have food, you won't have the energy to say I'm doing good. Yes. There's mosquitoes.
Speaking of
You know what? You talk about malaria.
We've got chikungunya here as well. So
I know.
It's not just malaria for us now.
Thank you. You have dengue also.
And dengue as well.
And you have mosquitoes in the hotel.
Yep.
Why?
They're seeking refuge.
Yeah. So thank you.
From the
That was
outside,
good.
yeah.
So do you have your card?
No.